When Vivi Butler underwent life-saving brain surgery, doctors did warn her that the 8-hour operation may damage the nerves in her face. And they were right.
The entire right side of her face was drooping, twisting her mouth awkwardly, and she was also unable to close one eye. As a result, Vivi spent 6 years unable to smile and was constantly embarrassed by her facial paralysis.
But just last year, Vivi came across a new treatment that would change her life forever. And she joins us now, along with her surgeon, Mr. Charles Nduka. And welcome, both of you. Vivi, I mean, you are obviously a very beautiful woman, and it was about 8 years ago, in the year 2000, and I think you're only in your early 50s.
Yes.
That you've been having headaches, you lost some hearing,
yes.
and things weren't right at all.
Yes.
And you didn't like going to the doctor, you liked the complementary therapist thing, so you didn't bother the doctor for a year.
No.
And finally you did.
Yep.
Sent you for an MRI scan, and
then I was told I had a brain tumour, an acoustic neuroma, which is, that's why I was deaf and made me slightly unbalanced. And he says, you know, it's got to come out straight away. So 3 weeks later, I was in the Royal Free Hospital having it out.
And where was it growing in your head?
It was in your inner ear, and it's sort of close to your brainstem. And it sort of pushes the brainstem to the side, so it becomes rather dangerous and it gets big.
Well, it was apparently the size of this satsuma here.
Yes.
And had been growing slowly for 30 years.
Yes, unbelievably.
Unbelievable. And you had to have it removed because they had to check to see if it was malignant.
No, it was never. They're always benign, never malignant. So that was the good news.
But you had to have it removed. Why?
Because it was pressing so hard on my brainstem that it was actually dangerous. Because I think all the sort of systems that sort of keep your body running are controlled by the brainstem. And sooner or later I would have got water on the brain or something. Then I didn't have long to live, apparently.
Oh my goodness. Well, your husband, your 2 children, they were very worried for you. You had the 8-hour operation.
Yes.
Beforehand, the surgeon did say, unfortunately, I have to cut through some nerves, which could leave you with damage.
Yes.
And of course, unfortunately, that's exactly what happened.
Well, they didn't cut through the nerves, but apparently the facial nerve would have been stretched as it grew, so that as the tumour grew, so the facial nerve then stretches. And sometimes it can be long-term damage. Some people get better within 3 months, and other times it can be permanent, like with me.
So you waited and waited. There you are. I mean,
yes, horrible.
Well, that's a long time ago. But
when you looked in the mirror, first of all, when you woke up from the operation and you recovered from the anaesthetic, an 8-hour operation.
Yes.
When you saw yourself, what did you say?
Well, I was in intensive care for a couple of days, and then when they didn't even give me a mirror for a few more days, and then when I did, I just looked very quickly, and then when I got home, I because I need to do exercises quickly, because I thought it would get better quickly, and I just felt quite horrified, but I kept thinking it's going to get better in 3 months, so it's just temporary, and I'll just put up for it for a little while. And so it went on, always thinking it would get better for 6 years, and having tried everything, it never did.
And then it was your son saying to you, Mum, happy news, I'm getting married. And you think, oh, that means I've got to have my photograph taken. Now is the time.
Yep.
I seek full-on medical advice.
Absolutely. Well, I'd always said I would never go to either of our children's weddings with my face like that, and that I would definitely do something.
Well, it had changed your whole life. It had changed the way you viewed yourself. It had changed your confidence. You apologised for your looks when you saw people.
Yes. Although, even though it sort of changed the way I looked and everything, I still felt very happy inside, and I sort of carried on with my normal life. So I didn't hide away or anything. But it was times like when I went on aeroplanes and everyone's seated looking at you, and I walked on, I just wanted to sort of like die because I felt so embarrassed about myself. But a lot of the time I forgot about it. I suppose as time went on it got better.
Yes, and but when you were walking down the street, you'd look into a shop.
I'd look into a shop so my face would be sort of hidden to the people walking past me.
And the practical things as well, trying to eat and drink, and because your eye wouldn't close properly, it would dry out, and water.
All horrid things, and I couldn't say all my words very well, like B's and V's. I sort of they sound a bit gobbledygoopy.
And then, how did you find Charles?
And I met the Miracle Man. Well, I found him through a lovely physiotherapist called Diana Gallagher from Manchester, and I'd actually made an appointment to see somebody else, and she happened to phone me, and I told her who I was going to see, and she said, oh no, go to Charles Nduka at the Queen Victoria Hospital. And so I immediately cancelled the other appointment and made one with him.
And Charles, you're the only man in the country who can do this operation, is that right?
Well, the operation was described originally in France, and I had the good fortune to meet the surgeon, Daniel Labbé, at a conference. And he described the operation a few years ago now, but it's technically quite challenging, and that's why it hasn't really caught on.
And this is known as the Labbé technique?
Yes, yes.
Well, we've got some slides here.
Yeah, sure.
Can you talk us through what I know you've got your dowel down there to point things out. So what do you do?
Well, there are 12 muscles involved in smiling, and clearly it's not possible to recreate all of those muscles. What we're doing is transferring a muscle on the side of the head called the temporalis muscle, which is here, and normally it's attached to the top of the mandible, top of the jawbone.
Yeah.
Now, there are 4 other muscles that are involved in moving the mandible, so you can quite safely sacrifice the one and still maintain jaw function. By detaching the muscle completely from its attachment on the side of the skull, you can also detach the attachment to the jawbone. You reroute the muscle so that the attachments on the skull and on the lips are changed via a break in the cheekbone here. So it's quite an involved operation.
Gosh, yes.
It involves peeling back all the skin from the forehead down to get access to here.
Wow. And then push it right down through here.
That's right. And so what you're doing basically is initially the patient has to clench their teeth, and that gives them the initial smile. Then with lots of practice, and Vivi has been excellent at practicing in the mirror, working at things, and eventually you learn how to move the muscle independently of the jawbone.
Well, it's another 8-hour operation
Yes.
and a big deal for you, because you know what's going to happen and how you're going to feel.
Yes.
And immediately it was done. What was the immediate thing that you felt had improved?
Well, it was a little bit swollen, of course, at first, and I funnily enough, I felt a little bit disappointed at first, because I think I'd expected it to be like it was originally. Not that Charles ever led me to believe that, because you know you can't achieve perfection with this. And so but then once I'd had my lips taken in, which I had to have 2 more little mini operations, having my lips taken in, a bit like a dress size taken in. And once I'd had that done, I felt really happy about it. But it took a couple of months, didn't it? I was a little bit funny at first. I think I expected much too much.
When did you have the operation done?
It was about a year and 4 or 5 months. It was last June, not the June you just had the one. Oh.
Last June.
Yeah.
And then you had the wedding.
Yes, the
and
wonderful
you have the
wedding.
wonderful photographs.
Yes.
And now you're a grandmother.
Yes.
And Charles, you say that you saw Vivi's confidence soar after the operation.
Yeah. The woman who came to the clinic, although she's very lucky, unlike many patients with facial paralysis who don't have the supports of a loving partner, family members, Vivi was very well supported, but the change in her after the operation has been really dramatic. You know, obviously, say she's a beautiful woman anyway, but her confidence is there. She no longer holds her hand up to her face when she's
Who else would this suit? I mean, people wake up one morning with Bell's palsy, or their face has dropped, or a stroke, or can you help a lot of different patients?
But the Bell's palsy is the commonest cause of facial paralysis, and many people will know somebody who's had a Bell's palsy. Unfortunately, the majority of patients recover from a Bell's palsy. About 80% of patients recover within a matter of weeks. But there are a significant number of patients who never recover their movement, and for them it's devastating, because they're told by their doctor, the GP, don't worry, it's going to recover, much like Vivi in a way. It doesn't recover, and they end up with functional problems, unable to drink in the public, unable to eat, speech is difficult, they end up with psychological issues as well, depression, anxiety.
And while people can say, well, this isn't a life-threatening thing, you're going to survive, it's certainly life-altering.
It is.
And it makes quality of life unpleasant and difficult. It's important to have it, isn't it?
It is important. This isn't cosmetic surgery. This is, the face serves a function of expression, and
it's your social tool.
Absolutely. Much the same way that a computer screen is a way of communicating with the person. Your face is your way of communicating pleasure, happiness.
And I mean, you have a lovely smile now.
Well, a little one, not a full, lovely toothy one, but a little one.
And do you still have to do exercises?
No.
That's all done now?
All done, all finished, just a normal person.
Fantastic. Well, thank you for coming today.
Thank you so much for having us.
Thank you very much indeed. It's absolutely fascinating.
Miracle worker, isn't he?
Oh, he is. That's
You're
right.
You're a model patient, of course.
Well, I don't know about that.
Well, for details of anything we've spoken about this morning, you can have a look at our website, itv.com.